Great. Good afternoon and welcome. I'm going to give just a moment for people to get logged on. In addition to Zoom, we're also live streaming over to our SCAD Alliance Facebook page, and we'll also email out a recording of this presentation afterwards. So welcome everyone to Ask the Experts, a conversation hosted by SCAD Alliance. If you're new to SCAD Alliance, we are a nonprofit organization founded by survivors in partnership with leading cardiologists and health advocates to advance the science of SCAD. One of our main goals is to support patients and families, and as part of that, we've developed this monthly webinar series. We hope to be able to offer support and education to survivors and caregivers by engaging in conversation with experts on SCAD-related topics each month. I'm Rebecca Freeman, and I will be moderating and leading our conversation today. I'm a board member with SCAD Alliance and a two-time SCAD survivor. I had my SCAD heart attacks at age 20 and 29 years old. In addition to being young, running and exercise was a huge part of my life. So figuring out how to safely be active was critical to both my physical and emotional recovery. For me, it's been a lot about learning how to listen to and how to trust my body. So today we're talking all things physical activity, both immediately after SCAD and long-term. Cardiac rehab, what is it, how are plans developed, and what to do if we don't have access to a robust cardiac rehab. Thank you to everyone who submitted excellent questions for our panelists. We're going to do our best to address all of them this next hour. So one thing about SCAD in general, but especially about exercise recommendations, is that there is minimal data on this. SCAD Alliance is developing a large multi-center iSCAD registry in hopes of eventually having a large data set. But at this time, there are no gold standard randomized control trials to give us concrete quality data. I know I personally am a smidge type A, and I'd love these docs to be able to give us hard and fast numbers to work with, but it's just not going to be possible. Plus, we're all individuals, and our levels of activity prior to SCAD will greatly influence our activity levels after SCAD. So please know that everything presented today is based on the opinion, the extensive experience, and the clinical practice of these clinicians. They're going to be able to give us a great overview and guidance on physical activity, but specifics for each of us really do need to be developed with each of our own individual providers. So I want to go ahead and give a quick introduction to all of our panelists, and then we will get started. So Dr. Melissa Wood is co-director of the Corrigan Women's Heart Program at Massachusetts General Hospital. She's an associate professor of medicine at Harvard Medical School. And Dr. Wood's a SCAD Alliance scientific advisor and a member of our iSCAD Registry Steering Committee. Dr. Sahar Nadiri is a cardiologist and SCAD specialist. She's director of Women's Heart Health at Kaiser Permanente, Northern California. Dr. Nadiri is also a SCAD Alliance scientific advisor and member of our iSCAD Registry Steering Committee. Nancy McCleary is a registered nurse. She's certified in cardiac rehabilitation with the MGH Cardiac Rehabilitation Program. And Maria Shea is an exercise physiologist certified in cardiac rehabilitation with the MGH Cardiac Rehabilitation Program. So thank you all so much for joining us today. We're going to start with cardiac rehab. Nancy, can you start us with an overview of cardiac rehab and why it's so beneficial for SCAD patients?
I'd love to. Hi, everyone. I'm really pleased to discuss with all of you the role of cardiac rehab for those who've experienced a SCAD. There's plenty of evidence and research to support cardiac rehab participation for SCAD patients, and it's been shown to be beneficial in a number of ways. I'd like to describe these benefits in this way. Typically, someone who's had a SCAD event has many questions, as you all know, and they seem to fall into the questions seem to fall into three categories, and cardiac rehab can help with those questions. The first one I want to talk about is the general question of, what am I feeling physically? Many folks experience many ongoing, sometimes new or recurrent different sensations and discomforts after their event. And collective experience suggests that chest pain is extremely common after a SCAD, occurring probably around a half of SCAD survivors. But put simply, this is enormously anxiety producing. And at the very least, it's confusing. So cardiac rehab can really help the individual to discern these various symptoms and try to figure them out and collaborate with their cardiologist and their providers for any adjustments that may or may not be needed. In this way, it acts as a great support system during these periods of uncertainty. So then the second category or group of questions might be under what am I feeling emotionally? And cardiac rehab can be a really critical support system. It can help the individual to manage, make sense, discuss the various emotional responses that they are experiencing, and ultimately learn new mind-body practices such as meditation to use as a tool for management of their normal anxieties and stress. You know, I was just working with someone recently for quite a while who had been experiencing chest aching after this person's SCAD, and one day went out for a long walk and found it dissipated, and said to me, wow, it's so incredible. I mean, I knew it academically, mind-body connection, but to experience it was really neat. And so I know a lot of you understand that exercise is actually a mind-body practice as well as a conditioning for our heart physically. And that brings us to the third question, which is, what can I do physically? Can I do what I've done in the past? And for some, their SCAD actually occurred during exercise, which puts a whole nother layer of anxiety around it. Many have expressed, actually Rebecca just did, that their bodies have betrayed them, or they feel like their bodies have betrayed them. And that's, I hear that so much, or some version of that so much. So it's really a scary and, can be very anxiety producing to get back to trying to develop an exercise regimen. And so that's where we come in, or where our cardiac rehab program can come in. It can direct a safe, effective exercise regimen to improve both cardiovascular conditioning as well as strength conditioning too. And this, and I think Rebecca referred to this too, this is done with a really individualized approach, taking into consideration that individual's medical information, their age, their pre-SCAD activity level, all those things are gonna come into play, so that ultimately achieving a very patient-centered recovery goal. This requires a prudent approach, I would call it, balancing the known benefits of exercise, both physically and mentally, we all know that, with any potential risk of the extreme levels of exertion or strain. So participation in cardiac rehab is paramount for addressing any symptoms, whether induced by exercise or not, plus providing immediate feedback on exercise response, and ultimately individualizing each participant's fitness needs. Everyone's primary goal after SCAD is to heal their heart in all sorts of ways. And cardiac rehab provides a great setting in which to do this. And if you don't have access to cardiac rehab, you can use some of these basic principles as you set up your own program. And my colleague, Maria Shea, is going to go into more specifics about developing an exercise regimen. So I'll turn over to you, Maria.
Okay. Good afternoon, everybody. It's such a pleasure to be here. And it's such a pleasure to work with our SCAD patients. And as Nancy just mentioned, and Rebecca as well, everybody is so individualized that there's an art and a science to coming up with the perfect prescription for each person. And so we're going to go through some of the general guidelines today for coming up with an exercise prescription. And I'm going to pull up my slides. Okay. So we're going to talk about exercise and cardiac rehab for the SCAD patient. And a basic exercise program, and this is good for those of you who have access to cardiac rehab and for those of you who don't, so you can kind of develop a program for yourselves, is to always start with a warm-up. You want to let your heart know that you're about to engage in exercise. You wouldn't have your car go from 0 to 90 without warming it up a little bit. So we always want to warm up before we exercise, and it can actually help prevent little squirrely symptoms that we have sometimes as well. So you want to warm up for about 10 minutes, and its warm up is simply doing what you're going to do for your cardio, but slower. And you want it to be light. On the next slide, we're going to talk about something called rate of perceived exertion. So you want it to be easy, light, and really about 10 to 20 beats above your resting heart rate for those of you that measure your heart rate. And then we're going to go into the training phase, which will be 30 to 60 minutes, and you're going to work up to that. Immediately post SCAD, you can start walking. In fact, you probably already will have been walking in the hospital around the floors, but you can start walking, but work up to 30 to 60 minutes. And again, as Rebecca said, it's all part of listening to your body. And again, what we want there, and we'll talk about RPE in a minute, rate of perceived exertion, you want to feel like you're working somewhat hard. So you want to feel like you can still have a conversation. If I was walking with you, we could still be chatting, but you're breathing a little harder and you might be breaking a sweat, and your heart rate at that point is about 60 to 85% of your maximum heart rate. Now, what's your maximum heart rate? So if you take 220 minus your age, that's your age predicted maximum heart rate. Now, if you're on a beta blocker, you want to take 10 to 20 off of that, and then take 60 to 85% of that number. And again, everybody's different, which is why at Cardiac Rehab, we really focus on the rate of perceived exertion. And then finally, after you're done in the training range, you always want to make sure you cool down your body so that your heart doesn't immediately, slam the brakes on your exercise session. And again, you're going back to about where you were warming up, and you're going to try to bring your heart rate back down below 100 beats per minute. This is the RPE scale we were talking about, and it was developed by Dr. Borg, and it goes from 6 to 20. In some places it goes from 1 to 10, but we use 6 to 20, loosely based on the heart rates of 20-year-old athletes, so 60 to 200. But 6 would be at rest. So, and as you creep up in the scale in the green, it's going through, you could be meandering around the house around 7 or 8, maybe some light walking around the mall at 9 or 10. And then when you get to 11, it's fairly light, and that's where you want to be warming up, okay? So it's fairly light, you're not really breaking a sweat yet, you're just, revving up your engine. And then when you get in your target zone where you're in your cardio, being 12 to 14, 11 to 14 is perfect. That's the sweet spot where you want to exercise. And again, here you're able to breathe, you're able to talk, you're able to, still break a sweat, breathing a little heavier, but you're not exhausting yourself. You're not working yourself to the extremes, which is when we start getting into that red zone. While your heart is healing, and really for most people, there's no benefit in exercising in that extremely hard zone. So exercising safely between 11 and 14, that 60 to 85% of your max heart rate, which often correlates to the yellow zone, as research has shown, that's your sweet spot. That's where you want to be when you're exercising. So again, listening to your body, being able to exercise where it's safe and it's comfortable in 30 to 60 minutes, and again, working up to that level. And then as we design an exercise program for our SCAD patients, we like to work up to the frequency of exercise of 5+ days a week. And the amount would be actually 30 to 90 minutes. So ideally it's 300 to 450 minutes a week of continuous aerobic activity. Now that's in addition to the other activity you get, shopping and walking to work or whatever, walking from the train station, all the other things you do. This is the continuous aerobic activity without stopping. And then again, as we recently discussed, 60 to 85% of your max. If you've had a stress test, which I neglected to mention in the last slide, if you've had a stress test, we would take that top number, the max heart rate, and take 60 to 80% of that number if you've had a stress test. But with COVID and with a lot of things happening right now, many of you have not had a stress test. So we're giving you some guidelines that you can use. And then the rate of perceived exertion, 11 to 14. What type of exercise is considered cardio? Well, walking is a great form of physical activity. Cycling, elliptical, rowing, swimming, anything where you're moving, even dancing, anything where you're moving your muscles continuously for 30 to 90 minutes is considered aerobic activity. So that's the type of exercise that we recommend. For strength training, your physician will give you a weight limit, and it's typically between 20 and 30 pounds, maybe a little more for some people, but you use your physician's guideline for how much weight you can lift. And the litmus test for strength training is you always want to make sure you can breathe through it. If you ever find you have to hold your breath and drop the weights to the floor like some of the muscle heads in the gym, then that's too much. That's too much. So you want to make sure you can breathe through it, almost make it like a moving meditation. You can do 1 to 3 sets, although there's a lot of data that show that 1 set is actually adequate and can give you a lot of great strength training benefits with 8 to 16 repetitions. When you get to 16 repetitions, if you say you're using 5 pounds, then you can go up and do 6 or 7 or 8 pounds. If that's 16 reps, you're breathing through it and it becomes easy. So that's a little bit of a progression plan there. And again, we went over the 5 to 20 pounds of intensity. We also like to recommend flexibility training, and that would be after your exercise session. And it's actually kind of a fountain of youth because it keeps your muscles limber and long, and it prevents you from being stiff. And you know, again, you're going to stretch the muscles that you use during exercise, but a nice overall stretch is great too, to stretch your calves, to stretch your quads, you know, to stretch your arms, to stretch all your muscles. And we don't any longer recommend the bouncing. We don't recommend that bouncing stretch that we used to now. It's just a slow stretch where you hold that muscle. And again, for strength training guidelines, follow your physician's recommendations for the initial limits, increase gradually, low weight, more reps, and then breathing, your moving meditation. Some special considerations regarding exercise for SCAD patients is to avoid prolonged high intensity exercise. Again, it's not necessary. It's not going to get you any closer to where you want to be than the moderate exercise that we recommend. Avoid highly competitive contact sports. Avoid activities performed to exhaustion. You want to stay in those zones that we talked about, the rate of perceived exertion and the heart rate range. Avoid abrupt increase in physical activity without warming up. Again, you want to let your heart know that you're about to do something. Avoid extremes in temperature. For example, hot yoga, and even, you know, the way it's been really soupy out lately, hot, humid, at least up here in the Northeast. You know, if you can exercise indoors, if you have access to a treadmill or some kind of, you know, indoor exercise, so that you can avoid that, and stay very hydrated when you're exercising, when it's warm. And think about that in the winter too. You want to avoid the extreme cold as well. And then, as we've discussed throughout this presentation, you want to avoid the performance of Valsalva, which is where you're holding your breath. And that's, you know, isometric exercise. You want to make sure that you can breathe throughout the exercise. If you have any questions, I look forward to answering them toward the end of this seminar. But for now, I hope I've given you some information that you can take with you and use in your daily exercise program.
Absolutely. Thank you so much for that, Nancy and Maria. That's a lot of great information of how it works throughout cardiac rehab and, you know, things we can do at home. And I had the benefit of completing cardiac rehab with you all at MGH, you know, and can definitely attest to the physical and mental benefits of such a great program. But one thing, we also want to discuss is that this isn't a reality for all patients to be able to come to MGH and see you guys, whether it's because of the pandemic or geographical location or any number of things. And so Dr. Nadiri, can you talk about recovery for your patients and other things we can keep in mind at home?
Sure. So thank you for having me. Hello, everybody out there. So we thought we would take a few minutes to talk about, as Rebecca stated, not all of us have access to this beautiful cardiac rehab program with robust services. And I'd say, MGH is probably one of a handful of programs out there that we can all be envious of. So they're very far and few in between, unfortunately, at least as of 2020. So I thought I'd talk through some of the challenges, but some of the things, I don't want it to be a discouraging part of this talk. So some of the things you can do to empower yourself and still get the benefits of cardiac rehab and the parts of cardiac rehab, you may just have to piece them together through some creativity. So just to kind of throw out some of the healthcare system barriers, I think if amongst the many things that COVID has done, it's really brought to light a lot of the gaps and cracks in our healthcare system. And I think cardiac rehab is not immune to those cracks and gaps. So, the dream pre-COVID cardiac rehab program is costly, amazing, but costly. So what you really want is a supervised exercise program with an exercise physiologist, who you're meeting today with Maria, mental health support with a psychologist in a beautiful world, a nutritionist, a dietitian, health coaching for health behavior change, and medication management. So this is the program that builds a robust cardiac rehab program. And in an ideal world, all these elements are in the same place at the same time, and you have access to them kind of in real time. But it's costly. And unfortunately, when it's costly, it's difficult to develop. We know that there's ongoing physician education that needs to be done in terms of making sure your physicians are actually referring you to cardiac rehab. So after your SCAD event, technically, you have up to a year where you can get referred to cardiac rehab. So it's usually not too late for a lot of patients, but empowering our cardiologists and physicians to really think about referring patients, particularly our SCAD patients, can sometimes be a barrier. And so there's more education that needs to be done in that realm. Other practical challenges. So we have this challenge in San Francisco. If you can see behind me, I share an office with one of my amazing colleagues because there's just no space. So particularly in bigger cities, the real estate to have enough space for a cardiac rehab program can be very challenging just because there's nowhere to put everything that you need within a healthcare system. The other practical challenge is, the MGH program, again, is amazing because the crew there understands SCAD. You're not walking into a rehab program where you have to explain the condition you have because, that trust kind of breaks down when you have to explain what SCAD is to begin with. So one of the difficulties that we have is that it is challenging to individualize cardiac rehab for each of the cardiac conditions. So I do a lot of work with aortic patients as well. And so the genetic aortic conditions, pulmonary hypertension, adult congenital, our SCAD patients, there's so many different groups that need cardiac rehab, and sometimes individualizing care so that the patient feels like they're truly getting care that is focused on them and their particular cardiac condition can be challenging. So there's some barriers that I don't think we can overcome in the future, but have led to a lot of challenges, I'd say, in the last decade since we first really started robustly studying SCAD. So from the patient perspective, you guys out there can correct me if I'm wrong, but I hear again and again from my patients that, it's demoralizing. I can't really relate to the other people at the rehab. I think it can be challenging when you're a younger, previously healthy man or woman, and then the person next to you is perhaps in their 80s, 90s, has atherosclerotic or plaque coronary disease, and it just feels like you can't connect to those around you. And I think part of the motivation and the beauty and the mental health boost that you get is looking around and feeling like there are other people like you. So I think from the patient perspective, that's a barrier. Time and cost. So a lot of individuals still have pretty robust copays for cardiac rehab. So cost can certainly be an issue. Travel time. So if you live in a more rural area or suburb and you live outside of Atlanta pre-COVID and sometimes it takes 2 hours to get to cardiac rehab. For us in the Central Valley, it's really hard to get from more rural areas to a center that has cardiac rehab. So travel time can certainly be a problem. Childcare and work schedule conflicts, it's really, really tough to find hours and time during a regular work schedule to do cardiac rehab, because almost all cardiac rehab is kind of a 9-to-5 program, somewhere in there. So I think getting the childcare or time off work to really focus on cardiac rehab can be challenging. A lot of the patients feel like it's too restricted. When it's not individualized to our SCAD patients, they feel like, okay, well, they're keeping me at this same heart rate. I don't really feel like I'm pushing myself. Nobody really feels comfortable pushing me further, and I just don't feel like I'm getting much out of it. Traditional risk factor discussions don't apply. So for our patients, they still get, and we certainly have SCAD patients who can improve their cholesterol and blood pressure and weight and those kinds of things, but that doesn't always apply to everyone. And so sometimes the nutrition and risk factor discussions don't really feel like they apply, and it makes for just an awkward relationship. And then providers don't know what SCAD is. Again, it's hard to have trust in the folks that are helping you with cardiac rehab if they don't really know what condition you have. So there's definitely patient perspective barriers we deal with. But on the positive note, I don't want anybody out there to give up. The reason why we decided this would be an important part of the talk is just to know we hear you, and we're working on it. And it's really challenging, but it doesn't mean that you can't get yourself where you want to be, even if you don't have this beautiful Massachusetts General Hospital cardiac rehab program. So in terms of the exercise prescription, you can still get a baseline treadmill test to help guide your program, as was previously mentioned. So in the era of COVID, this is getting a little bit tricky because we're increasingly wondering if just breathing out into a closed space puts you and the person who's conducting your treadmill at risk. And so your particular institution may not be doing treadmill tests. We are at Kaiser San Francisco, so at least as of now. So you can always ask and say, hey, can I do a treadmill test to help with my exercise prescription? And then once that treadmill is done, at least here, what we used to do pre-COVID was, because we don't have the manpower for everyday physical therapist who can provide cardiac rehab to all of the patients that we have, because we have millions and millions and millions of patients within Northern California, they would do 1 or 2 sessions a week to kind of help supplement what you would do at home. Now, in the post-COVID world, we're doing virtual visits where a physical therapist, because we don't have exercise physiologists, kind of talks you through how you can exercise at home. It sees if you're having symptoms, reaches out to your cardiologist, and tries to develop an exercise program from home. Remember that some of the initial exercise restrictions can be liberalized. So I'd say I try to start our patients, obviously every person is different, but start them out low and slow. And a lot of that has to do with what multiple people have already said about trusting your body. I think until you can trust your body, it's really hard to kind of ramp up. So we usually take some time to just kind of go low, trust your body, listen to your body, see how you're feeling, and then we can ramp up as you're feeling more comfortable moving forward. Do your research. So at certain institutions, there's opportunity to partner with another program that can do cardiac rehab. So there are multiple institutions in Northern California that do not have their own cardiac rehab program, and they partner with another institution. So just make sure you do your research, find a cardiac rehab program near you that could work for you, and then talk to your doctor about it. Keep your cardiologist updated. Even if you don't have a robust cardiac rehab program where you are, it's okay to keep plugging away, talking to your cardiologist. Some of my patients, I would say a good portion of my patients, the first 6 months or so, we're in pretty regular, sometimes weekly contact about exercise and how the patient's feeling and how things are going, and that's okay. Your cardiologist needs to be there for you if you don't have a robust cardiac rehab program to kind of build to where you want to be. Focus on what you can do, not what you can't do, and just deal with it day by day and ramp up as you can. We don't always get to kind of our pre-SCAD level of activity right away. And I think you just kind of have to take it day by day and see how things go. But I think there is a way to develop an exercise prescription for yourself, even without a robust cardiac rehab program. So for the lifestyle modification piece, what I always say is, you know, if you are somebody who has issues with high cholesterol or high blood pressure or weight or whatnot, and these are kind of things that keep getting brought up in your discussions with the cardiac rehab folks who may not be in tune with SCAD, have your cardiologist reach out to whoever's doing the health coaching or the lifestyle modification piece so that they have an understanding as to what your condition is and how that might be different from a plaque rupture heart attack, so that you feel like you're establishing a relationship with someone that understands what the diagnosis is. The other big piece is the mental health piece. You know, again, in a perfect world, every cardiac rehab program would have a psychiatrist, a psychologist right there that can work with you because the mental health piece is such an important part of the physical health piece. But that, again, is unfortunately not a reality, but that doesn't mean that you can't get a referral to a mental health specialist. So this is a really important part of the mental health piece. I make it routine to make sure to touch base with my SCAD patients therapist to explain at least kind of the basics of SCAD so that your therapy sessions are more robust and more useful, and the therapist kind of understands where you're coming from. I'd say that this is really one of the huge parts of cardiac rehab, but even if it's not built in, it can be done as an adjunct to make your cardiac rehab program more robust. So the virtual world. So pre-COVID, some institutions, recognizing the barriers to in-person rehab, have moved to the virtual space. We were headed in Northern California in that direction, and then COVID hit, and then all plans for anything innovative kind of got sidelined a little. But while it's gotten sidelined, in some ways it's become a quicker reality for most in the country because we still need to support our patients after SCAD and other forms of heart attack. So for instance, Southern California, our Kaiser Permanente program in Southern California has a pilot study. It's an 8-week virtual program developed with the help of a cardiac rehab team. And there's your smartwatch is paired to your smartphone, and it reminds you to exercise, collects patient data, documents your heart rate, and it gets uploaded into the chart, and the team can track your progress. The patients also meet virtually with a care manager once a week to talk through any concerns. And then there's an 8 to 12 week program with a health coach that's offered if desired afterwards. So we're hoping that we'll bring this program up north at some point, but the point of all of this is not to throw out propaganda about our health system, but rather to say something along these lines you could do with your care team. So I think there are ways to, for those of you who are savvier than I am with your Fitbits and your Apple Watches and those kinds of things, there's still ways to virtually develop a program with your care team and still do cardiac rehab, albeit not in its classic form, but perhaps in a form that might be more conducive to your schedules and time, and those kinds of things. So yeah, that's all I've got. But I think there's definitely things that you can still do outside of a robust cardiac rehab program.
Yeah, thank you for that. Absolutely, Dr. Nadiri. I think it can be so tough. You know, we're juggling a lot of things in recovery, and these are some really great ways we can work, you know, on this physical and emotional recovery anytime and any place. Dr. Wood, I want to turn it over to you. We've talked a lot about cardiac rehab. You know, what next? What else should we know?
Yeah, so it sounds like, I think we're a little short on time because I know you have some amazing questions, and I want all of the people who sent in questions to feel like their questions will be answered. And I had some kind of cool slides, but I think I'm going to not use slides and just sort of make a few points and emphasize really what we've heard so far, and then launch into the questions where I think many of the things I was going to touch on probably will be brought up. Very important that you speak to your team wherever you are about the importance of cardiac rehab. Cardiac rehab saves lives. Women are less likely to be referred to cardiac rehab, and we know that women with SCAD and men with SCAD may be, in many cases, less likely to be referred because of a false perception that exercise is actually dangerous. We know that exercise with appropriate guidance is certainly important, not only to help you recover from your SCAD, but to help reduce long-term cardiovascular risk. I also want to emphasize that cardiac rehab not only is a way that we will learn how to become healthy through exercise, but also, as we've heard, the anxiety and stress management components are also incredibly valuable. And we hope that your team can assist in creating a wellness program for you that's individualized. And then finally, I would like to mention that for our very, very fit patients who have SCAD that want to be able to resume some level of exercise at a higher level, we really need to individualize, and it's very important to remember that the cardiopulmonary exercise test is a great way of developing an individualized plan for you. And that's where your exercising and measurements of your VO2 or oxygen consumption are taken, and we are able to use that to really develop very precise numbers as far as heart rate, perceived level of exertion, etc. And using a CPAT, we can actually determine when you go from aerobic exercise, which is where your body is easily using oxygen, to anaerobic, which is where you start having to create your own energy substrates. That point, inflection point, is the point at which you start feeling really breathless when you're exercising. And if we can give you heart rate guidance so you can anticipate when you're heading into that zone, that will be really helpful to keep you exercising in a safe fashion, whether you're a previously competitive athlete or not. But in particular, for those who are very, very fit, that's one method of us being able to develop a safe sort of return to exercise program for you. I also want to say that while there has been research, and both Vancouver and Mayo have written up their individual cardiac rehab programs, and those are great references, I think we still do not have enough answers to many of our very important questions about cardiac rehab for SCAD patients, and therefore we want to continue to gather data, and things like the iSCAD, which will be a way of looking at the experience of hopefully thousands of patients to really be able to inform the development of more precise guidelines in the future. So with that, I think I will turn it back to Rebecca, who I think has a nice list of recommendations and questions from the audience. So thank you very much.
Yes, thank you so much. And we have a lot of questions. I know you guys have covered a lot of things already, and I really thank you for that. I do want to start with one for the cardiologist, and that is, somebody says, can you explain the function of the heart during exercise and how SCAD changes this? I know SCAD, the effects of SCAD can be different for each patient, but just in general, as we're thinking about exercise and physical activity, what is different about our hearts now after SCAD? Start with Dr. Wood.
Sorry, I'm just trying to get my slides here. So I want to share a slide with you guys, if I can. And this is a slide. Are you able to see this slide?
Yep, perfect.
Okay, great. So this is a slide that really shows you, and this isn't in particular pertinent to SCAD, but in general, when we participate in endurance versus strength activities. So endurance activities allow us to have a sustained cardiac output, or the amount of blood that our heart pumps in 1 minute, the number of liters of blood. When we exercise, that goes up dramatically, so 4 to 5 times when we do things like cycling, running, cross-country skiing, rowing. And that's accomplished by our body increasing our heart rate. And to a far lesser extent, the blood vessels also accommodate to that increased heart rate and increase the amount of blood delivered with each beat from our heart. Also, our blood vessels can relax a bit during that type of exercise to help us safely deliver that oxygenated blood to those muscles that really need the blood, not only to deliver oxygen, but then to carry away the toxic waste that's produced during intensive, long duration exercise. That is opposed to strength exercise, where with strength exercise, we have sudden, dramatic increases in the stress that our body is creating with the lifting or whatever the activity is that's associated with that, strength. And that results in elevations in blood pressure that can actually be quite dramatic during that lifting phase. People also often perform the Valsalva, where the mouth is closed, the glottis is closed, and we push down and hold our breath. And that also puts increased stress on the walls of our blood vessels, not only our blood vessels like our aorta, our intracranial blood vessels, but also our blood vessels to a less extent within our heart arteries. This is also coupled by what we call increased afterload, which is where our blood vessels, instead of opening, they actually clamp down a little bit because of that increased force exerted when we strain or bear down. So in patients who have had SCAD, for a variety of reasons, there may be a detrimental effect to performing high intensity strength activities because of that intermittent strain and stress that's put on the blood vessels of the body. Endurance activities, where there is more of a warm up and not a sudden change in the strain and stress on the blood vessels, perhaps is much more safe. Again, we don't have a lot of data, and actually up until 10 years ago, we didn't have a lot of data in healthy athletes, but certainly in SCAD patients, we haven't had a lot of data to look at the direct physiology, but we know that our recommendations that you have heard already are based on our understanding of the unique physiology associated with athletic participation.
Awesome, that makes a lot of sense, thank you. One question we did get, and just jumping onto that, is, so how, knowing that information, how can we work on muscle tone, specifically core strength, when we do need to be careful about bearing down our weights? Are there specific things we can do, whether it's certain activities or certain weight limits?
I think that's great for Maria, our exercise physiologist.
You're on mute, Maria.
You're on mute.
You're on mute. Can you unmute yourself?
Yes, I got it. Okay. Yeah, so we talked about that a little bit when we touched on strength training. And again, as Melissa just said, just avoiding the Valsalva, where you're holding your breath and you're straining. Really, there's nothing wrong with strength training as long as you're breathing through it. So if you were going to do crunches, you're just on the floor, lifting up, facing the ceiling and breathing. It's almost like we talked about, a moving meditation, or bicep curls, where you're using weight that you can feel the muscle working, but it's not like you're really grunting and grinding when you're doing that exercise. You can, again, breathe through it without holding your breath, to avoid the vascular changes that Dr. Wood was speaking of. So I hope that answers your question, but yeah, strength training is safe and it's good for you. It's just doing it within those limits.
Absolutely, thank you. lots of people have asked if they need to be monitoring their heart rate using some sort of device, whether it's looking for certain numbers on their Fitbit or their Apple Watch or whatever, or if they can listen to their body and how to navigate knowing that right level of exertion.
Well, I'm happy to take that.
Yeah.
I'll tell you, I think two things, and they sound opposing. One is, I think it can be helpful, particularly if you've had some guidance and you know where your heart rate should go. And if you aren't so savvy in paying, for whatever reason, you're not paying attention to yourself. Maybe you're driven by other factors more than how your body's feeling. Because there is a certain individual who wants, like someone who's on a Peloton and sees a leaderboard and they're like, they got to ramp it up because they got to get to the top of the leaderboard instead of focusing on their body. So having said that, I also see, so I think it's got value to go, okay, all right, I got to back off. That's too much. But on the other hand, I see people that get so focused on it that they see one blip and they're into a panic attack. So we got to find that middle ground. I think it's really helpful if you can really use it appropriately to guide you and to help you listen to your body. I think it's great.
Thank you. Dr. Naderi, did you have something you want to add or?
No, I totally agree with that. Usually I sit down with the SCAD patients and I'm like, what kind of person are you? Are you a data person or are you more of a how do I feel person? So the how do I feel folks, we do a lot of exactly what Maria was saying, which was breathe through your exercise. You should be able to have a conversation with the person next to you. You can be a little short of breath, but you should be able to finish your sentence. That usually indicates that you're not driving your heart rate up to exhaustion or to more concerning levels. But then some of my patients are like, that's great when you tell me all of that, but I want you to give me a heart rate cutoff. And then we kind of adjust it as the months and years go on and as things progress. So I think it just depends on what kind of person you are. I wouldn't get discouraged if your doc recommends one or the other. It just kind of depends on your personality.
Absolutely. Thank you. Maria, I know you talked a little bit about this, but we had several questions with different specific cardio exercises, running, elliptical, rowing, that people participate in regularly. And I think you talked a little bit about this, but wanting to know just ways we can make these activities safer, whether it's the duration, the intensity. I know outside temperature does play a factor. Are there certain things we should try to optimize?
Yeah, again, I think it's really starting slow and progressing gradually and staying within the heart rate range and how your body feels. Again, you're right. It's some people are data people. I have a patient who has data collected for everything, like every heart rate, every exercise is on her board. It's, she's a data person and she likes to really watch her heart rate, but other people really want to go by how they feel. So again, it's the increase of the heart rate to where you can carry on a conversation. You're going to be a little more short of breath. But that's going to be, you can do any of those exercises, any cardio exercise, as long as it's within safe climate, within heart rate range, within the rate of perceived exertion.
Wonderful. Thank you. This question is a little bit is exactly specific to COVID. But I would say when you were talking, Dr. Naderi, about masks and those things, so wearing a mask, that has been a recommendation lately. Is there any problem to that? Is that harmful at all? Is there any factors we should know about that?
So I think, there does seem to be some, maybe some false information that wearing a mask is somehow could be detrimental to your health. And we've certainly found no data to support that. I think that wearing a mask, if anything, is probably going to keep you safer than not wearing one. I think one of the things that often comes up, and I'd be interested to see what Dr. Wood has to say, is when you're exercising wearing a mask. I have to say, for me, it's a little bit challenging to go for a run with a mask on. So if you're potentially somewhere where you can keep your distance, you know, more than 6 feet apart. So what I've been recommending to my patients is early morning exercise when it's less crowded during the week, or sometimes in the evenings because it's still lighter outside, and avoiding kind of the middle of the day, you know, like if everyone's out for 4th of July, you know, you don't really want to be going for a run then. And then maybe you can have a little bit more freedom safely to not wear a mask if it's really feeling confining while you exercise.
Awesome. Yeah,
I'd agree entirely. I run at 5:15 in the morning, or I get on my bike in my basement, whose name shall remain nameless, but it is a bike that allows me to train indoors. And I do think that being able to have a little bit more control over my training environment, especially when it's really hot outside right now and really humid. So I think having your own equipment is really helpful in this type of an environment, but if not, getting outside really early. And, you know, I look like a zigzag going back and forth across the road. So when I see some, because I don't run with a mask on because I run so early and I stay more than 12 feet away from people, but I cross the road if I see someone coming, and very carefully, of course. So I think individualizing again, but doing what works for you. But when you're out there in a big city or in a place where you can't have space, you need to wear something over your face.
Wonderful, thank you. I know our family's been hiking a lot just to try to do something outdoors away from other people. This question is it specific, and we're gonna have a future webinar on some of the associated conditions like fibromuscular dysplasia or other conditions associated with, that may be associated with SCAD. But are the guidelines for exercise any different if you have one of these, you know, if you also have FMD or another condition, or who should we talk to about navigating that piece as well?
I'm happy to take that. I mean, you know, part of our evaluation of every SCAD patient is sort of to develop a deep understanding of what their vasculature signature is. And that usually involves, you know, some type of imaging, usually with CT imaging. And if I am caring for a SCAD patient who has pretty significant vascular coexisting problems, like, you know, dissections, aneurysms, aortic aneurysm, then I of course create a more conservative lifting program for them, and especially, you know, different positions, different things that they may want to do. Certainly we want them to continue to doing isotonic, you know, exercise, but we'll be a bit more conservative. And I think the appropriate people to discuss that with, if you're, you know, you have a cardiologist who's comfortable, or a vascular doctor who's co-managing your fibromuscular dysplasia or other connective tissue disorder. So it's just like our Marfan patients, our patients with Ehlers-Danlos, and other, you know, vascular conditions. We will look at your personal situation and try to come up with something that works. We want everybody to move and everybody to maintain cardiac fitness, but safety is really important.
Absolutely, thank you so much. And just so everybody watching knows, we did take all of our questions in advance, which is why our chat is disabled, just so that we had time to be able to prepare as panelists and cover as many topics as possible. But anything that you're submitting that we don't get to, you know, please reach out to us, and we're always happy to get information to people. One more question that kind of to really anybody is, you know, closing thoughts about the physical and mental benefits of exercise. I know we really focused on the physical benefit of it and some of the logistical aspects, but I didn't know if anybody had additional thoughts about just how important it is for people to get back to some physical activity.
I'm happy to take that one. I think in addition to all the physical benefits we talked about, exercise actually puts you in the relaxation response. So it can actually take you out of that stress response, that type A response that you're working with all day. So there are many benefits in addition to the physical benefits that you get with physical activity. Even now with, you know, COVID and, you know, all the arguments people are having online and things that, it's a stressful world right now. And I think to be able to go out every day and take a walk takes you also out of that stress response. And, you can look around at the trees, you can notice the beauty and just be in the moment, be right here, right now, because we can't change the past and we can't change the future, but we can decide to put on our sneakers and go for a walk. So it can change your whole mindset.
I just have one thing to add to that, Maria, a cute little story that kind of demonstrates that. A woman I knew who was, one day she found herself with such a high level of anxiety that she just couldn't stay still, and she just ran out of her house and began walking. And 45 minutes later, she found herself across town a lot calmer. And she thought to herself, aha, okay, now I get it, why this is so powerful. And so she kind of finished the story by saying, so now I walk for my soul and my body tags along. So it's a really kind of a nice way to demonstrate how great exercise is for that mind-body connection.
Absolutely. Thank you so much. Do either of you have anything else to add? Otherwise, I'm going to.
I just wanted to give a quick plug for our patients who still have ongoing angina after their SCAD or chest discomfort, because I know sometimes it can feel like a very lonely world when everyone else is talking about the runs they're going on and the biking they're doing and all the physical activity they're doing. But I'm still a firm believer that you can get on a walk program and we can support you through so you can feel like you can do some amount of activity. And I'd love to hear what Melissa, Nancy, and Maria have to say just kind of as last words about that, because we'd love for everyone to be able to get back to doing all of the things they want to do and hope we can get you there, but sometimes that's not the total reality. So that would be the only other thing I wanted to bring up.
I think walking is such a great, it's like the best exercise. I mean, I'm a lifelong runner, but I love my walks. And I don't know if any of you have read Thich Nhat Hanh, but he is I believe he's still living. He's a Vietnamese Buddhist monk, and he writes a lot about peace and meditation and inner peace. And he describes something called the walking meditation. And what's so nice is it's a real twofer. You can get out, improve your cardiac, fitness, and also just develop that soothing kind of Zen experience of that repetitive motion, kind of just enjoying your, surroundings. And I love nothing more than getting out and going for a long walk. And I think for my patients who may be limited, may not have been able yet to do their stress test or get into virtual CR or in-person CR, I think just getting out and walking at a pace and on terrain that's comfortable for you is fabulous. So thanks for bringing that up.
Absolutely. And CR being cardiac rehab, just for anybody. So I want to just wrap up and say, this concludes our second annual, or not annual yet, but our second Ask the Experts conversation hosted by SCAD Alliance. Thank you all so much for joining us, and a big thank you to our panelists. This has been really informative, really empowering. A link to this recording will be posted on our social media pages and will be emailed out to our listserv. So be sure to subscribe to our newsletter at scadalliance.org and follow us on social media. We do plan to have our next one at the beginning of August. So look forward to that. And we will solicit questions in advance for that one as well, usually about a week in advance. Thank you so much for joining us, and we hope to see you next month.
Bye.
Bye-bye.
Bye.